Bismillahirrahmanirrahim. Few days before, I just shared a quiz, cath quiz. I think you all must be remembering that quiz that what we presented. This was the quiz, and I asked a question that a cardiologist is going for a coronary angiogram through radial route. So what's the problem he faced and how to overcome? So here, if you see, the problem is very clear, and some of you have answered very rightly that the problem here is that he has difficulty in passing catheter from this place. And remember, when you're doing coronary angiogram or angioplasty or any procedure, never ever push or pull against resistance. Neither push nor pull if you have resistance. You have to think of what's going on. So what happened after taking the radial route, the cardiologist had a problem advancing catheter from this point to actually want to go through this axillary to subclavian ascending aorta and up to the coronary sinus. So that very frequently you expect in radial, you expect resistance at any place, even at elbow or anywhere. So advance very delicately, and if you found, don't push it, never ever. So advance very delicately, and if you found any resistance anywhere, that's the golden rule. To overcome that resistance, first take out your guide wire and take an injection. And here, after taking an injection, he has seen that there is a tortuosity bend with maybe a minor occlusion, or it may be totally a bend. So during this bend area, what you have to do, you have to overcome for passing of your wire through a hydrophilic wire. So hydrophilic wire can overcome these issues, but after even passing a hydrophilic wire, then exchanging it with a hard wire, sometimes you may have difficulty in doing your procedures. For that, you have to do something. But for sake of overcoming this kind of tortuosity, here at this spot, you have to use your hydrophilic wire. Long sheath can't be suitable at this point. For femoral approach, if you have any problems, tortuosity in iliac or femoral, we used to have a long sheath that can overcome, but in radial it's difficult. So that was the answer of that quiz. I hope whoever is learning coronary angiography should care about all these things, that should be very careful in that. Thank you very much for your listening.